Hello friends, today we are going to discuss about the myofascial pain dysfunction syndrome. It is commonly called as a MPDS also. Here we will discuss the aspects related with the symptoms of the MPDS, its pathophysiology, natural course of its occurrence and diagnosis as well. In addition, we will see the treatment aspect of the same and effects of the various factors on the pain symptoms and course of the disease. So, if we see the nature of the myofascial pain, it can be very localized to diffuse headache along with the neck pain. Here, the pain is probably the most common initial complaint for the patients, and it is usually seen by the general physician or an ENT physician rather than the dentist. Sinus pain, headache are the main complaints along with the sore throat, and which is also very common associated complaint for the patient with the MPDS. Perhaps the most common or difficult symptom for the patient to understand are the complaints of the dizziness, tinnitus, that is ringing into the ears, and loss of hearing or altered sensation of the hearing. If we see, almost 60 to 70% of the patients with the myofascial pain dysfunction syndrome, we have noticed that they have one or more of the above said complaints, and they are usually mistaken as a very different disease rather than myofascial pain. Let's see how we'll diagnose the myofascial pain dysfunction syndrome. So myofascial pain is very common and frustrating problem, and usually a reason for the adult patients to go for an ENT surgeon or ENT physician's visit. However, myofascial pain is a diagnosis of exclusion. It means that the ENT physician or a doctor will look for the other reasonable causes of the pain prior to making the diagnosis of MPDS. Although myofascial pain is very common, a physical examination is required to rule out the other causes of the referred pain. For example, ENT pain can be the only symptom of the throat and voice box cancer, so this cannot be neglected. The physical examination will include the detailed examination of the deep throat and the voice box along with the endoscopy and CT scan view and blood profile if required. Our first priority should be to rule out anything serious like the throat and voice box cancer or any other throat infections or any other serious condition related to the ENT area. So before making any diagnosis of MPDS or arriving at the diagnosis of MPDS, we must rule out and keep in the mind to not to neglect the other serious conditions just because of MPDS. Now let's see the common observations of the myofascial pain and the characteristic of the typical myofascial pain along with the factors which are going to alter the nature of the pain. So we see that the sleep may either improve or worsen the pain. It is usually worsened with the stress. So sleep may not be directly related with the type of the pain and characteristic of the pain, but stress is directly associated with the pain's nature. Apart from this, it is noted that the cold is going to intensify the pain, whereas the heat is going to improve the condition, so it is going to relieve the pain. The pain may come and go with what may seem like a random pattern. The myofascial pain may intensify with the jaw manipulation, for example popping of the ears and chewing the gum. The myofascial pain may be associated with the tooth grinding like habits of the bruxism or night grinding. Apart from this, it may be triggered by a change into the diet, activity and lifestyle, for example after injury, surgery or a simple dental treatment. Now let's see the common observations of the myofascial pain and the characteristic of the typical myofascial pain along with the factors which are going to alter the nature of the pain. So we see that the sleep may either improve or worsen the pain. It is usually worsened with the stress. So sleep may not be directly related with the type of the pain and characteristic of the pain, but stress is directly associated with the pain's nature. Apart from this, it is noted that the cold is going to intensify the pain, whereas the Heat is going to improve the condition, so it is going to relieve the pain. The pain may come and go with what may seem like a random pattern. The myofascial pain may intensify with the jaw manipulation, for example popping of the ears and chewing the gum. The myofascial pain may be associated with the tooth grinding, like habits of the bruxism or night grinding. Apart from this, it may be triggered by a change into the diet, activity and lifestyle, for example after injury, surgery or a simple dental treatment. Okay, let's see what is neural feedback. The neural feedback is a involuntary reflex mediated by the spinal cord, and sometimes it is altered by the brain. In myofascial pain condition, the pain is sensed by the spinal cord, which in turn creates the muscle contraction, and the muscle contraction intensifies the pain. The pain stimulates the contraction, and contraction it exacerbates the pain, so it becomes a vicious cycle. The factors like stress and anxiety may intensify the neural feedback and making the problem worse and very difficult to treat. Unless the neural feedback is suppressed, the problem will not improve and it may go worsening and ultimately leading to the possible permanent physical damage. If we talk about the referred pain, so referred pain is the pain that is originating in one part of the body, but it is felt entirely into the unrelated part of the body from the origin of the pain. It is a result of a wiring of the nerves, and it is especially common into the head and neck region because the embryological development of the head and neck regions, the cranial nerve branches grow in many directions. For example, the ear pain may be caused from a dental or tonsil infection or just a simple canker source into the throat of the mouth or the tongue. It is possible to have the ear pain without any symptoms into the mouth or throat. Other causes of the ear pain or the referred ear pain include deep jaw and throat muscle and the jaw joint itself. So for many patients it is very hard to believe the pain they are feeling is not actually coming from the ear. So we have to make them understand the situation, and their belief plays a very important role into the treatment part of the MPDS. Now, after successfully arriving at the diagnosis of myofascial pain dysfunction syndrome, that the condition is myofascial pain and not any other ENT or dental condition, we have to look into the aspects related with the treatment. So if we talk about the treatment, probably the most important factor for successful treatment is acceptance by the patient. Generally, patients have a very hard time accepting the diagnosis of the myofascial pain because they cannot relate themselves with such type of the situations. The concept of treatment is very simple. We have to just break the vicious cycle of the neural feedback and the condition will automatically get improved. When a patient fails to accept the diagnosis of the myofascial pain is occurring because of such type of the situation, it is very unlikely that the patient will able to prevent the neural feedback mechanism. Here the brain can modulate the neural feedback, but the factors like stress and emotional reaction can significantly amplify the feedback. In addition, a patient's response to the situation like pain or sensations may make the problem going to worse. For example, the ear pain or fullness may cause a patient to try to pop their ears by moving or manipulating the muscles of the jaw and throat, which in turn irritates the jaw joint and strains the muscles responsible for the pain. Other habits like jaw clenching with the stress and vigorous chewing of the chewing gum with the emotional stress are going to affect the treatment in a similar way. So now one thing is clear, that breaking the vicious cycle of the neural feedback is the key to the successful treatment of the myofascial dysfunction syndrome. now let's see the factors which are going to break the vicious cycle of the neural feedback. First one is heat. Heat is going to relax the muscles, so a warm electric heating pad on the affected area with the minimum 60 minutes per day is advised. Second one is massage. This is the form of biofeedback mechanism. Here a patient can train themselves to identify when the muscles are tight and they try to relax a muscle or a group of the muscles. Third one is advising the soft diet. Here avoiding the foods which are difficult to chew like sticks, carrots or any other durable foods are going to help positively. Gentle jaw exercise may be helpful, but chewing gum is usually harmful and should be avoided. Fourth one is the anti-inflammatory medications. In certain situations the medications becomes necessary, so the anti-inflammatory medications or NSAIDs like ibuprofen or the prednisone are advised. These medications need to be taken well beyond the termination of the symptoms for maximal benefit for the patients of the myofascial dysfunction syndrome. For ibuprofen, the dose is usually 800 mg 3 times a day on a regular schedule for the 10 days. The next option available for the treatment is muscle relaxant medication. Here the muscle relaxant like chlorzoxazone may reduce the neural feedback and pain and reduce the chances of bruxism, that is jaw grinding during the sleep. Other treatment option available for the myofascial pain is dental appliance. Dentist can make a bite guard that can reduce the pressure of the jaw clenching or night grinding of the teeth. The pressure exerted on the jaw joint or the temporomandibular joint is going to be reduced by the bite guard, which in turn eliminate the effect of the bruxism. In certain cases with higher pain threshold or very intense pain, the trigger point injections are advised. If a distinct spot can be identified, a simple injection of the local anesthetic or an anti-inflammatory steroid may improve or cure the myofascial pain. The next is physical therapy. It is noted that certain physical therapy or physiotherapy movement are going to improve the situations of the myofascial pain dysfunction syndrome by relieving the neural feedback and relieving the muscle stress. Thank you friends. We hope that you have understood the myofascial pain dysfunction syndrome thoroughly, and if you like our lecture, then please stay subscribed, stay connected for the upcoming lectures.